Okay, we're going to conclude our discussions of chapters 19 and 20 by talking about the complications of surgery and medical care. The complications that occur only in other body sites are classified in those chapters. For example, a complication of GI procedure is going to be in the diseases of the digestive system. Complications that happen that affect multiple sites or body systems that are not classified anywhere else are going to come to the T80 through T88 codes. Intraoperative and post-procedural complication codes are found within the body system chapters, with codes specific to the organs and the structures of that body system. So there's a lot of words, but I think as we look at some codes, it'll make more sense. When you're looking for a subterm that indicates a post-operative or an iatrogenic condition, you may or may not find any subterms. And if you don't, then start using complications as your main term, and then start looking at the subterms under complications to help you find these codes. An iatrogenic condition is a condition that results from the treatment of another condition. So there's two things going on there. Read the instruction notes carefully, in particular the exclusion notes that are related to complications, because it might be that the correct code would be in a different chapter of the ICD-10. And by using those instructional notes, it can help us prevent some of those mistakes. Not all post-care conditions are classified as a complication, so your documentation has to state that whatever is occurring is unexpected or is abnormal. There has to be a documented relationship between the condition that's being treated and the care that's being provided, and the doctor has to say that it's a complication. We cannot make those assumptions on our own. When you have complications that are involving an internal device, an implant, or a graft, that's going to be classified first. It's important to distinguish between an admission for complications and admissions for any routine or scheduled aftercare follow-up to procedure. And as I just said, we can't make assumptions because of the legal ramifications of complications to procedures. People sue doctors. We never want to make those assumptions when we're assigning codes. We only want to code whatever the doctor has said. At the beginning of the T80 through T88 range, there are instructional notes that tell the coder to use an additional code for the adverse effect. And if you recall, the adverse effect is in the code ranges T36 to T50 with a 5th or 6th character 5 to indicate it's an adverse effect. You're going to use an additional code to identify that whatever condition is resulting from that complication, as well as any devices involved and circumstances that are involved in this particular code. Those Y codes are external cause codes. So if you want to look at those and look at your options there, it might be helpful to help you remember what options are there for coding. Okay, the first guideline under complications of care refers you to the general coding guidelines for documentation of complications. And this is just a restatement of what I said earlier, that it has to be documented that what we are presenting is a complication, and the doctors have said it's a complication, because not everything that happens after surgery is a complication. So we have to get very confirmed documentation that it is a complication, and there has to be a cause and effect relationship between the care that the patient is receiving and that condition. If you have any doubts of whether or not something's a complication, you're going to always do a query because of the ramifications of you coding something that isn't a complication. The next coding guideline has to do with pain due to medical devices. If you have pain associated with a device that's left in a surgical site, for example, a hip replacement or a knee replacement, you're going to find those codes in Chapter 19. But if you are looking at codes for pain due to medical devices, that's going to take you to the T codes, and you're going to look at additional codes for the pain categories, G89, to identify if it's acute or chronic pain due to the presence of that device. Here's an example of pain due to medical devices. Chronic left breast pain secondary to a breast implant. So this would have been a case where the device was left in. If we go back up here, Chapter 19, device left in, is T85, complication of breast implant. We're also going to code the breast pain and the chronic pain. These codes standing alone do not give the reader much information, but when you combine the three codes, you now know there's a complication, the complication is pain, and the pain is chronic. By using those three codes, we tell the story. There's also transplant complications other than the kidney. They break out the guidelines to separate the kidney transplant versus other transplants. T86 is for complications of transplanted organs and tissues, and those include complications and rejection. You only assign a transplant complication code if the complication affects the function of the transplanted organ. Two codes are required to fully describe a transplant complication: the T86 code and a second code that identifies that complication. And any pre-existing conditions that developed after the transplant are not complications unless they now affect that transplanted organs. A lot of words there, so you're really going to have to remember, if you're coding a transplant, that you're going to refer yourself back to those guidelines and review them time and again until you can remember them. At the end of this section of the guidelines, the coders refer to other chapters for more information. Information regarding removing a transplant is found in the Z codes, Chapter 21, and codes related to malignant neoplasm or cancer of a transplanted organ takes you back to the guidelines for Chapter 2, neoplasms. Now let's talk about kidney transplants. Patients who have undergone a kidney transplant can still have some form of chronic kidney disease because the kidney transplant doesn't always fully restore kidney function. You're not going to use the T86 complication code if the patient still has chronic kidney disease unrelated to the transplant. The T86 code is only for complications of a transplant, like for rejection or failure. In this diagnostic statement, the patient received a kidney transplant 2 days ago. The transplant appears to be failing. We will continue to monitor the situation and determine next steps. Complication for transplant kidney rejection is here, and then the transplant kidney status is also given. The T86 code should not be assigned for post-kidney transplant patients who have chronic kidney disease unless the complication is documented. This statement we've been given here: the patient was admitted with chronic kidney disease stage 4. He received a kidney transplant 3 years ago, but full kidney function was not restored. More than likely, he's going to need dialysis. We're going to code the chronic kidney disease and the transplant status. We are not going to use the T86 code because this is unrelated to that transplant. This is a chronic kidney disease that he had before, still has it, unrelated to the transplant. There are complication codes that include the external cause, and I've given you an example here where the patient has a fractured right tibia shaft. The physician went in, tried to stabilize that bone, and now they're thinking there's an infection internally at the fixation site. That is a complication of the fixation device, and we're going to assign this code T84, and we're also going to assign the traumatic fracture of the tibia shaft. Complication of care codes within the body system chapters. I'm going to show you sometimes you can look through the different body systems, and it's usually towards the back of the chapters that it starts talking about intraoperative and post-procedural complications. This particular statement: there was a spinal fusion, the surgeon inadvertently punctured the dura, I'm going to show you an image on the next slide of what that is. That was repaired and the fusion was completed. So the coder is going to code the accidental puncture of the dura. And this is one of those situations I've mentioned to you throughout the semester where the alphabetical index gets you in the neighborhood, but maybe not in the exact house you want to be in. So I would take this G97.48, knowing that that fifth character of an 8 is a more non-specific code. So I'm going to always look for a more specific code when I can. And in this case, I've been told that the dura has been punctured. It's pretty specific. So you're going to go to the tabular, go to the G97 category, and start looking at the codes to see if there's anything more specific than a code that has a fifth character of 8. And we notice that it does. There is a code very specific to accidental puncture of the dura, G9741, and that would be the code that we would use. In the next slide, I wanted to show you the dura and what we're talking about. The dura lies just over the spinal cord, so it shouldn't happen, but it's probably not hard to do to accidentally puncture that when you're working on this vertebrae and these bones. Just wanted to show you that so you can keep that in mind. Okay, that's all I have for the complications. If you have any questions, please post them in the discussion board, along with the path that you've tried to find the answer, and I will attempt to help you. Thanks so much.